The recently passed Inflation Reduction Act revived the national conversation around the price of insulin, which diabetics use to manage their disease. The bill takes some steps to cap out-of-pocket cost for the life-saving drug, but as Mitch Legan reports, advocates say it doesn't do enough, and many Hoosiers will continue struggling to afford insulin.
For the last 12 years, insulin has dominated Molly King's routine.
It has 7 grams of carbs, so that will play into how many carrots I use.
King is a type 1 diabetic, which means her body doesn't create insulin, the hormone that regulates her blood sugar. Without it, she could have serious medical problems, including blindness or even death. So she keeps careful track of what she's eating and injects herself before every meal.
So you hear that? I use a long-acting insulin that I take twice a day. The short-acting insulin that I take is what changes based on my food intake and my current glucose numbers.
King is one of an estimated 1 million Hoosiers living with diabetes. Not all diabetics need insulin, but she says for those who do, it's become increasingly difficult to acquire. King was first diagnosed with type 1 diabetes in 2010. Since then, the monthly cost of her insulin medication has ballooned from about $300 to over $1,000 today.
I'm 30 and I live with my parents because my medication is so expensive. I knew financially I couldn't. I would either have to choose to pay my bills or pay my rent or keep myself alive for another month.
King's situation isn't unique. The price of insulin has more than tripled in the last 2 decades. During the same time, the 3 major insulin providers, Sanofi, Novo Nordisk, and Indianapolis-based Eli Lilly, raised their prices nearly in lockstep. That's led to lawsuits against the companies for collusion. But they say the prices are due to the U.S.'s complicated medical landscape, and people generally don't have to pay the full list price.
So we know that insulin only costs about $6 a vial of insulin to produce, and yet each vial is over $300 if bought out of pocket at the pharmacy counter.
So Casper, King, and other advocates were disappointed when the Inflation Reduction Act made it to President Biden's desk. When it was introduced, it had the potential to make major changes to insulin prices.
It doesn't necessarily help people who are going to be most impacted, including people with private insurance and people without insurance.
The bill contains a $35 insurance copay cap for people on Medicare, but an initial version of the bill contained a section that would have applied to those on private insurance too. Most Senate Republicans voted against it, including Indiana's. They said it would have violated budget rules.
It does not help the majority of people with insulin needs, and so we're still pushing for a total retail cap and not just a Medicaid or Medicare cap or an insurance copay cap. We want a price cap.
Insulin advocates say a price cap would help everyone who needs insulin. A copay cap only helps people who have insurance and still allows for drug companies to charge what they want.
We know that 1 out of 4 patients with diabetes has rationed insulin due to cost. And we think that number is probably even an undercount because a lot of folks don't recognize that what they're doing is rationing.
In a statement, Eli Lilly said it was in favor of the private $35 copay cap that failed in the Senate. It also said that anyone can buy their monthly prescription of insulin for no more than $35 through its discount programs. But those insulin discount programs are often difficult to navigate.
If you are not already established with a primary care provider, or if you're not already seeing a diabetes specialist elsewhere, it is difficult to access because most people can't navigate those resources on their own from the internet.
King isn't on a Lilly brand of insulin, and she's exhausted the discount options available to her, so she'll continue paying $1,000 a month for her medication. She's happy to see Congress take some action on insulin prices, but she says it's a long way from making a difference for most Hoosiers. For Indiana News Desk, I'm Mitch Legan.
The American Diabetes Association says it plans to continue advocating for relief this fall, including the Insulin Act, which calls for capping monthly insulin costs for a broader patient population.